Good afternoon, and thanks for joining us for today's Healthline 3. I'm Courtney Butts, and today in studio we have Shed It Weight Loss and Wellness, and we've got to know you guys over the last couple of months, and so today, of course, Shed It Weight Loss and Wellness, we are talking about weight loss, but I got to introduce you guys first. Irina Haas-Ghattas, owner of Shed It, and Catherine Rogers, physician assistant with Shed It as well. So thanks, ladies, for being here.
Thank you. We're excited to be back.
Absolutely, and this is kind of a good time for people to start thinking about weight loss if they, maybe have some specific goals. It's crazy that it's already April in 2025, and we probably started out strong on January 1st, maybe set those New Year's resolutions and then maybe revisited them, and this is another time. Right, yes, and this is another time to maybe revisit those as well. So so we're kind of talking about getting ready for summer, right?
Exactly. Yeah, now it's really the perfect time to get started if you want to get ready for your, Memorial Day trip. So now is really the time because you need at least, I would say, 3 months at least.
Yeah, that's a good perspective. 3 months, 12 weeks, 90 days gives you a good amount of time to see good change.
Yeah.
And so it's not fast and furious to where you're having to worry about, compromising your health as well.
Exactly.
Yeah, so tell me first a little bit about Shed It. You mentioned in our midday newscast you're about to celebrate 3 years of Shed It in Bossier City, but tell me, what was your vision for bringing it to Bossier?
So, believe it or not, this area here, our metro region, Shreveport-Bossier, is truly one of the heaviest, unfortunately unhealthiest in the US. There was just a report that came out couple of days ago, and my friend from Houston actually sent it to me.
Yeah.
And he said, yeah, you are in the right business because Shreveport is, I think, the third unhealthiest and biggest city in the US.
Wow.
So 3 years ago, we could already see that there is some potential changes that can be made here in our community. This was also the time of the rise of the GLP-1 injections, semaglutide at that time. And we thought it would be a great opportunity for us to help the community here and make Shreveport and Bossier healthier.
Absolutely, yes, and it's Shed It on Shed Road, so easy to remember, right off of Shed Road. And what's a good marker for people to find you?
It's basically very close to the intersection of Benton Road and Shed Road.
Okay, easy. Okay, and so, the GLP-1 you mentioned, and that's kind of a buzzword, GLP. A lot of times I've even seen where people will say, this is the natural semaglutide or the natural GLP-1, and that's not really necessarily true. You can't really eat food and make this GLP-1 hormone in your body, or block it, which is what these injections do. So tell me, Catherine, how they actually work and how you can't really replicate it with anything else.
Yeah, so these are the GLP class of medicine. That's glucagon-like peptide. They've been around a long time, used for diabetics. They're working on a GLP receptor on your pancreas, basically helping your body produce more insulin, which is going to better regulate your blood sugar. So over time, as we eat just our American diet or just things that our body becomes less okay at regulating the blood sugar. So once that glucose is running higher in your bloodstream, that over time leads to that insulin resistance and eventually prediabetes and diabetes. So this is actually going to help your body naturally produce more insulin, better regulate that, which is sort of that mechanism behind why it's been used for type 2 diabetes for so long. More of the weight loss indication that they found sort of as a byproduct from diabetics using it was that it also works on that hunger hormone. So just kind of helps with, we call it food noise or cravings, just always that, craving something sweet, salty, what it may be, but it helps with that individually. And then it also can slow that stomach and GI motility, so stomach, colon, everything in that GI system, which is able to help you physically feel fuller sooner and longer. Now that comes with, side effects and things that are always a warning label there. But basically, in a nutshell, that's how they're working, is on those GLP receptors, doing several different things to promote weight loss, promote better blood sugar, and just overall a better, healthier way of living.
Yeah, okay. And so let's say somebody at home is interested in starting these and they want to make an appointment. How soon can they get scheduled or expect to be scheduled?
Right now is our busy season, but it's usually the same week.
Nice.
If it's more like off season, then sometimes even the same day.
Okay, yeah, so if somebody is like, okay, I'm ready to do this.
Yeah.
Like we said, 90 days or 3 months, maybe if you have a vacation planned, or like those Memorial Day, all these outdoor activities that people tend to spend outside by the pool, then this is a good time to get started. But
Exactly.
you also offer a pill form if somebody doesn't want to do the injections.
Correct,
So
yes.
tell me about that.
So the pill that we offer is called Qsymia. It's extended release phentermine with Topramex, which also helps to curb your appetite. So it works a little bit different than the GLP-1 class of medication that we do.
Okay. But similar maybe results in some ways, or is it?
I mean, maybe not to the same extent, but
Right.
also good success.
Yeah.
We recommend it mainly for the people that do not have as much weight to lose.
Right. Okay. And for people that maybe don't tolerate the needles
Correct.
as well.
Correct. Yes.
Okay, cool. And if somebody did want to start the injections, is that something that you guys can help patients with that don't like needles? They can come up to
Exactly. So that
during
is a
office
free
hours?
service that we offer. They can come in to shed it for their weekly injection, and then our wonderful medical assistant helps them with it. So they can look the other way, and then just beep, and it's over.
And it's over. Okay, cool. So let's say that someone is wanting to get started, and what's a realistic weight loss goal for those 3 months or 90 days? And Catherine, maybe you want to take a stab at that one.
Yes, I think that the injections, we've said a couple of times, but it's more of like a tool. They're going to help with portion control. Other things that are going to be important are going to be, protein and fiber in your diet, drinking lots of water, exercise, any kind of strength training or cardio. The injections, I think, definitely help guide in weight loss, but a lot of it comes down to that lifestyle modification too. I think technically anywhere from 1 to 2 pounds a week is going to be your safe, so 4 to 10 pounds a month basically. Now people that start the injections can have bigger amounts of weight loss, but I would say kind of safely and sustainably anywhere from that 1 to 2 pounds per week is really going to ensure that we're getting good calories, getting good nutrition, in a good spot with the calorie deficit, and then able to see some weight loss.
Yeah.
So that's, when we said 3 months was a good time, I think that gives you a realistic time, especially if people want to say lose 20, 30 pounds, between now and summer. If we really, get down to it, look at our diet, modify some of that, be sure we're eating good protein, eating good fiber, starting or trying to do some exercise. Obviously some people have limitations and need to talk to their provider or start slow there. But I think that's kind of a safe way to do it.
Right, and right now we're kind of talking in general terms because we don't have, we're not talking about somebody specifically, so obviously it's going to change a little bit person to person.
Right.
Based on, other underlying health issues and things to consider. And it's also important to note that, like you said, 1 to 2 pounds per week, that equals to about 12 to 24 pounds. But for someone who has less to lose, it may look more like 5 to 10 pounds.
Right,
Yes,
right,
absolutely.
yeah.
So it definitely
really is very individual and depends on the person.
Yeah, and that's the great thing about, some places that offer the GLP-1 injections or, just weight loss options, oftentimes you may not see this one-on-one approach, right?
Yeah.
And so, that's what we love about Shed It, is that you guys, spend a lot of time with the patient.
Yeah, that's where we really take our pride. It's very important for us to not just send the patients away with a medicine and then, see us later or whenever you need a refill. We really go every step of the way. If there's a little problem, like we are just a call away, Catherine always tries to help if there's, dosing adjustments needed, or if patients maybe have some nausea, she can call in Sofran, and that is of course free of cost as well. We're there every step of the way.
Awesome.
And we also celebrate the success with our patients.
Yes, and that's important too.
Yeah.
You want to have the accountability partner, but you also want to have somebody that you can, celebrate with, and feel like you have people on the journey with you.
Because when you see them, like some patients that don't like the needles that come weekly, you see them every week for months, and they become like family members.
Yeah.
So it's
love
exciting.
that.
Yeah.
Well, cool. Well, if you're just joining us and you have a question for Irina or Catherine, this is Shed It Weight Loss and Wellness, and it's located Shed It on Shed Road in Bossier City. If you have a specific question, maybe about GLP-1s, the weight loss injections, or the oral option as well, or any other services that they provide, give us a call at 318-219-4569. We'd love to take your questions and provide some answers with our experts. And as well as that, we did talk about maybe there's some before and after photos that you guys have sent in with some of your patients to show what kind of progress that someone can expect, you know, with working with Shed It. So I'll let our people upstairs get that loaded on our monitors so you can see that, and we'll show that in just a second. But so with the GLP-1s, oh, here we go. Yeah.
Yep, here are some really
pictures, like you say.
crazy transformations. These were all people that not just had some pounds to lose, but their goals were bigger. And yeah, I think it's amazing, the progress you can see there.
Yeah.
Like life-changing, truly.
And the big thing about this is that this would technically be like a quote non-scale victory. You know, sometimes people get so focused on the number on the scale that they maybe forget how things change, how their clothes fit.
Exactly.
You know, and the inches. So is that something that you guys also evaluate as well?
Yes, absolutely. And we also have a tool for that. It's our beloved Fit 3D scanner, which is my favorite tool. So it is really important with weight loss to consider what you're losing. Like you have to consider your body composition, and it's muscle, but it's also fat. So you want to make sure that you lose the fat and keep the muscle, or gain more muscle.
Yeah.
Because for sustainability, this is the only way. You want to make sure that your muscles stay there so that your metabolism doesn't crash.
Yeah.
And if that happens, if you don't have any muscle on your body anymore because you lost a lot of weight, but not the right part of your weight or the right fat,
right,
it's very, very difficult.
Yeah, and if you have, you know, the way that, like you said, body composition, like even some of your patients may be recompositioning, so they're losing fat and gaining muscle through being strategic, you know, eating enough protein, eating enough fiber, so you're still full, and then, you know, still exercising as well. It's not just take the injection and then never think about that, like you mentioned earlier, Catherine. So one thing that I think is interesting too is these started out as medications that helped with diabetes or someone that had a high A1C. So let's talk for a second about how, you know, the role of insulin, which is a hormone in the body, and then, you know, first of all, let's talk about the prediabetes range, what A1C is, and, you know, when you should maybe consider diet modifications. So let's first start with, what is A1C, the percentage?
So that is going to be just the range of what your blood sugar runs over a 3-month time period. You know, so they can check like your fasting blood glucose, but that hemoglobin A1C is actually going to show that range. So they've got, I think anything less than 5.7 is going to be normal. That 5.7 to 6.4 is going to be in that pre-diabetic range, meaning, you know, we're not there yet, but if we don't make some lifestyle modifications, we're certainly working on it. And then anything over that 6.5 is going to be considered diabetic. So once they start talking about lifestyle modifications, you know, like we've been saying, the protein, the fiber, complex carbs, just things that aren't going to turn directly into sugar as soon as we eat them. And then you'll want to do that for about 3 months, and also adding in exercise, things like that. So, and that after that 3 months, you can retest and then see what that hemoglobin A1C is showing at that point, because that's going to be that lifespan of that. So, you know, like I said, once we start to get in that pre-diabetic range, I think we certainly want to make some lifestyle modifications. Even once we're inching up to that, I think so. But then certainly once we become, you know, diabetic, that can actually be reversed, or at least, you know, changed once we have those lifestyle modifications. Now, obviously, some people have, you know, family history of diabetes, which is going to make them just more susceptible to having it in general. Sometimes just our lifestyle or our diet right now, you know, some people end up needing medications in either way. So, you know, we try to do lifestyle modifications, but some people are going to require medicines. But it certainly is something we want to, you know, take care of sooner rather than later. Just the more studies they've been showing about diabetes and even Alzheimer's complications, kind of things they're starting to link that to, all from that, you know, just sugar running so high.
Inflammation too,
Yeah. So definitely things we don't want to get behind on, and want to be sure that we're, you know, doing what we can to stop that, or at least, you know, slow that progress.
Yeah, and also, so you're talking about diabetes, type 2 diabetes, and that's when you're insulin resistant. And so insulin is that hormone. So tell me, kind of explain what that means to our viewers, like when you are insulin resistant, and how, you mentioned it a little earlier of how these medications help, but how the medications help you to be a little bit more insulin sensitive.
Yeah, so they are working on that GLP receptor on your pancreas, so they're actually helping you produce some more of that. So that insulin resistance is just the overtime process of your body's glucose, which is blood sugar, just running higher in your bloodstream. Insulin actually helps just your body know what to do with that, whether that's stored in skeletal muscle, whether that's burn it, whether that's, use it in different places, but you don't want it running just so high in your bloodstream. That's where we become that insulin resistant. Then your body actually makes more insulin, and then it doesn't know what to do with it, so it just sort of becomes a negative feedback loop there. And so these injections really help to go in, produce more of that, but then better regulate sort of what your body's control center is doing with all this glucose, so that it doesn't continue to run so high. And insulin resistance, metabolic syndrome, PCOS, there's lots of different, they're linking a bunch of inflammatory conditions now to just this insulin resistance or this elevated glucose level. And so, yes, they're treating diabetes, they're treating obesity, but I think that the more that they find and do these studies, the more they're going to see that there's really other things that they're helping with too.
Yeah.
I feel like we have a whole subset of people now that we're seeing from rheumatologists, things like that, at these micro doses or just the super, super low dose. So not necessarily even for weight loss, but just for inflammation. So I have people that tell me, my joint pain was better, my inflammation seemed better. And so, cases of people that are being referred, chiropractors, things other than just for weight loss that are just showing to help from that inflation. So
very cool. Yeah. Well, that's exciting for hopefully the future of the class of medication as well. So, that's not all that you guys offer. You have the medications and the oral and the Fit 3D body scanner, but what else does Shedit offer as well for your patients?
We also do the Gallery multi-cancer test. It's a blood test that basically checks if there is cancer cells shed into your blood. And it discovers a lot of the cancers where there is no screening. So about 100 different types.
Wow.
So
okay.
it's really for early care, preventative. This is the one test that you want to do. Problem is, it is not covered by the insurance, and it's $949.
Okay. Yeah. So, but it's something that if you maybe suspect that you have something that's in your family, or you just
especially when you have a family history and you are over 40, 50 years old, I think this is a great tool for every single person out there.
Yeah. Okay. And has any of your clients maybe discovered that they have?
Thankfully not.
Okay, good.
Thankfully not, but at least it gives you the confirmation that at that point you're good. But it's recommended that you repeat that every year. I mean, just like your regular screening for breast cancer or cervical cancer.
Yeah, just because one time it's good, it doesn't mean that it couldn't develop later in life.
Of course,
too. Yeah. Okay, so you got the cancer screening as well. And am I missing anything else that you guys cover? You do a lot of different things, right?
I mean, we do lipotropic injections.
Yes.
That's our lean and sexy shot.
Yes.
It's basically a blend of patented amino acids with some B vitamins, which helps with energy and shedding fat, specifically on your midsection. And then we also have B12 and D3 injections.
Awesome. Yeah, and those are B12 and D3 are so important for like the energy as well, and so
for the immune system, for the bone health.
Yeah. Cool. Okay, so you're not just focused on the weight loss, you're focused on the person as well, getting rid of the comorbidities, the inflammation in the body as well. So it's one thing to focus on looking better, but it's also really important that you want to feel better too.
Yes, correct.
So I'm sure that's something that you'd say a lot of your patients would say that they also, it's a success for them, that they feel
100%,
better.
100%, yes, absolutely.
Okay, yeah, and maybe talk about some of those success stories. If you can think of some on the top of your head of, you don't have to name names, but just some of those people that you work with. Not only are they losing weight, but what else are they getting back in their life? Are they gaining confidence? Are they, what are some of those things that you've noticed?
Yeah, I had somebody last week that had come in on 3 different blood pressure medicines, and now she's down to just one. And obviously that's followed by her physician as well, but just being able to get on less medication. People have had cholesterol look better. Got several people that have just non-alcoholic fatty liver disease, and they've been able to, just from weight loss in general, have liver enzymes looking better. So I think people that have needed hip surgery or, surgeries that they've been able to postpone or at least recover better from after, seeing some weight loss. So I would say just reduction of medicines and then just better quality of life. People that can get around better, they can ambulate better now. They don't have all the pain getting up. Have people that say they play better with their grandchildren now from just losing weight. So, better sleep, just more energy. Lots of different things that I think people benefit from besides just the aesthetic part of weight loss.
Right. Yes, and you mentioned the Gallery test was not covered by insurance, but unfortunately these weight loss injections, what does that look like for insurance coverage? Okay.
So if you are diabetic, the Mounjaro is usually covered. In the beginning, I know there were way more lenient and you can get your free samples, but unfortunately that has changed actually a while back. But if you're type 2 diabetic, you can get the medicine covered. And also if your employer opts in with your health insurance, like it is employer dependent, then Zepbound or Wegovy may be covered.
Okay.
So I mean, it never hurts to reach out to your insurance and see if those GLP-1 medications are covered under the health insurance plan.
Okay, and if it's not, what can patients expect?
Then we start semaglutide at $199 per month.
Okay.
That includes the medicine, the provider visit with Catherine, and a fit 3D body scan, and also a monthly nutrition seminar. Tirzepatide starts at $299 a month.
Okay, yeah, so there's semaglutide and tirzepatide. Can you tell me the difference between the two?
Yeah, they're both that GLP class of medicine. Semaglutide is working on one of those GLP receptors, and tirzepatide does work on two of those GLP receptors. Semaglutide is going to be the compounded form of like the Ozempic or the Wegovy for people that have heard, commercials. And then Mounjaro is going to be the tirzepatide or the like Zepbound. So.
Yeah. Okay. So, I've even heard you guys talk about how some of your patients will respond really well to one and maybe not so great with the other one. So have you seen that consistently, or it just kind of depends on the person?
It's really person to person there. We sit down, like I was saying earlier, come up with weight loss plan, sort of how we want to get there, come up with medication, and that's why those monthly check-ins are so important. So then we sit down again, in a month, see how we did, what kind of progress we had, if we had symptoms or side effects. And so from there, if we did well, we leave it at that same dose, try to be conservative there. If we feel like we needed to increase the dose, we can. If people really didn't have good result or seemed like they just had a lot of side effects or symptoms, oftentimes we'll switch and try that other option and see if we do better there. So again, there's no one size fits all for it. It really is, individualized and person to person.
Yeah, okay. And you mentioned going slow on the increasing of the dose. So is that something that you feel like maybe a person can adapt to? Can people, I don't know if this is just out of pure curiosity, if somebody can adapt to like a lower dose, and then you have to, you plateau and then you have to increase it. So have you seen that at all?
Yeah, I definitely think people can plateau. I think your body adjusts to it. I think, and sometimes we can obviously make dietary switches, things like that, increase protein, watch, calories, kind of see how much we're eating. But I think the body definitely can adjust to some of those doses, or, we hit plateaus where we do need to either increase the medicine or make changes there. So, obviously it's not just, magic. We have to do the work at home too, as far as diet, exercise, things like that. But there definitely are, reasons to increase dose, or finding that we've, hit plateaus and need to make adjustments. So.
Okay. And I'm sure if you were to go from 0 to the highest dose, you would see lots of bad side effects and stuff too. So that's another thing, method to what you do is when you're dosing is you don't want those side effects either. And so
they can slow that stomach and GI motility. So I think if you are too aggressive with them too fast, and people have said, whether they were doing it from an online company or just kind of not as regulated, they had severe side effects, or, had nausea, or had, heartburn, things like that, just because if we do too much of the medication too soon, it can shock your system or overwhelm your system, your GI system, and give side effects and issues. So
is there anything in the GI system like nausea, vomiting, diarrhea, constipation, or combination?
Yeah,
of
all of the above.
Okay, or and And also, you know, like you said, sometimes you don't really know where you're getting some of these medications if you get it from someone that's maybe not as reputable. So where do you guys get your semaglutide and tirzepatide injections?
We work with a compounding pharmacy.
Nice.
Yeah.
Okay. And so it's compounded, so that's why you're able to get it
Yes,
a little
correct.
cheaper.
And they also send it out to third-party testing to make sure that the potency is right and that it's sterile. So we have had great success.
Nice. Okay. And if somebody, you know, wants to start on the injections, but the monthly fee seems maybe out of their price range, is there options for them to, you know, I don't know, payment plan or anything like that, or what?
We
does that look
offer
like?
like a 2-week,
Okay.
like a 2-week prescription, basically.
Okay.
Or like a 2-week medicine.
Yeah, yeah.
Yeah, model. So they can pay twice a month, basically.
Gotcha. Okay. So there's options out there. And with the injections, you're taking that once a week, right?
Correct.
Versus the oral, is that every day?
That would be daily, yes.
Okay. Okay. So it kind of is, you just kind of have to, that would be something that you would decide, I'm sure, in that first session, like what is most realistic. You know, I feel like the once a week to me it's easier to be compliant with that, you know, right? And I guess what happens if you're not consistent with the oral pill? Is there any, you know, negative side effects that comes with that?
Not necessarily negative side
Yeah,
effects.
okay.
It's just not going to be in your system. You know, just the half-life of it's not long enough. So if and I do have people that either will wean off of it or even treat that more of like a maintenance strategy. They'll do that every 2 or 3 days. Just
Okay.
kind of depending on where we are, you know, and how we're doing and maintaining and then what our goal weight is.
Yeah, and that's a good point too. So if somebody, I mean, some people will say once you start on these, you shouldn't get off of them, but you know, it's not realistic for somebody to maybe, you know, financially sustain that. So what is recommended for if somebody's trying to either maintain or slowly come down off of them?
So we, most of the time, will have them stretch out their injection. So instead of doing it every 7 days, they'll actually start doing it more like every 10 days into every 12 with, you know, maintenance looking more like every 14 days. And then we also can decrease on that dose so that we sort of taper down that way too.
Okay.
So some people end up at just a very low micro dose for maintenance, and then some people actually will wean off of them.
Okay, very
Just
interesting.
depending, like you said, kind of lots of different things. How we're doing, other comorbidities, financial situation, if people want to be on them forever, if they want to wean down. So, you know, we take all that into account whenever we come up with we call it exit strategy. So.
Yeah, yeah, and hopefully we've established those, like you said, the layered lifestyle habits that when you do get off of them, because obviously if you start and you don't change anything and then you get off of them and you still don't change anything,
You're not set up for success. Definitely not.
So, and that's something that I think a lot of times we forget. I always think like, let's get back to the basics. It's always been about, you know, diet and exercise as well. And this is, like you always say, it's a tool. And we don't want to abuse the tool, but it can work really nicely if we've got ourselves set up for success.
Exactly.
Yeah.
And that's why we are here, and this is why you should really take advantage to see Catherine every month, because she will discuss all these little details with you and set every person up individually for their success.
Okay, one thing that I forgot to talk about is we have Easter coming up, and we have just about 90 seconds left. So top like 3 to 5 tips that you would give somebody that's nervous going into Easter gatherings, and you know, lots of gatherings that will be coming about, you know, in the next couple of months. And I think this is a time where like weddings and showers and things are happening as well. So what are those tips that you tell your patients, you know, when they're going out and about?
I just, you know, be sure to be hydrated, drink lots of water. If you've got a late lunch or a late dinner, don't show up starving, you know, have a good protein, something before, so that you can eat, you know, in moderation. You know, take a walk afterwards if we've had a big lunch, go do an Easter egg hunt, run it off.
Yeah, I love that.
But just kind of, you know, staying active. Don't skip on what you just absolutely love so that you feel like you deprived or didn't have it. But just, you know, high protein when you can, and then drink lots of water and enjoy the day. It's a day, you know. So you don't want to get set back or feel like you missed out on the family gathering or the, you know, church gathering just because you were on a weight loss journey. You know, you got to be able to fit it all in and include everything, but everything in moderation.
It's got to be realistic and sustainable.
Right.
Everything in moderation. This
Yes.
is really the one thing for your lifestyle.
Yeah.
For sustainable until,
Right.
the end of days.
What you can do for every day and keep up. Yeah. Okay, really quick, where can we find you guys online and in person?
Yeah, so we are located in Bossier City, 2211 Shed Road, Suite B is our address. We are online, shedit.com, and you also find us on Facebook and Instagram and TikTok, Shedit on Shed Road.
All right. Well, thanks, ladies, for joining us. Thank you for joining us. Have a great day.
Thank you.